So, Dr. Ajit, Dr. Ajit, are you there? That our Honorable Vice Chancellor has joined. Yeah, Dr. Ajit.
Hi, sir. Good morning.
Good morning, sir.
So I'll just share the reminder once.
Yeah, please. I'm seeing that Dr. F.S. Mehta Sahab, VC Sahab, has joined.
Hello, sir. Good morning.
So I will send one more reminder.
Good morning.
Yes.
Take your time. I'm just.
Yes, sir. Just I'm sending the reminders to all the.
Whenever you, I'm just ready. Whenever you say, I'll start.
Yeah, sure, sir. Thank you.
Good morning, Dr. Ajit, sir.
Hi, good morning. Rajput sir, good morning. Very good morning,
Sir,
sir.
Yeah. Morning, sir. Morning.
Thank you
Because,
very
Sir,
much. We are very glad.
sir, we are very.
We are very glad.
I'm in quarantine, so please don't mistake me. All right. Okay.
No problem at all.
Sir, it is
Very,
our
very
pleasure,
glad.
sir. Pleasure to be you to be here, sir.
Thank you so much.
एकदम चार चांद लग गए.
नहीं, I
So nice
promise
of
you.
you.
नहीं, Dr. Ajit ने रात में मुझे मैसेज भेजा 11:30 something. I said I promised him that certainly I'll be here.
Sir,
कल
we are
कल ही
glad.
कंफर्म हुआ था ये सब एक्चुअली प्रोग्राम सर.
नहीं, actually, this is also surprise to me. Surprise to me also that Rajput sir is also joining, sir.
No, अजीत सर हमेशा ऐसे बोलते हैं तो हम अजीत सर को तो कभी मना कर ही नहीं सकते. He's always there. He's a part of our
Sir is very kind, very kind.
Rajput sir, we are having our honorable Vice Chancellor also. He also has joined. Just within a few minutes we will join. Dr. F.S. Mehta is there, Vice Chancellor of Gitanjali University.
Very nice. So please don't mistake me. I'm in this very casual.
Sir,
right?
sir.
I'm just resting on the bed, right? So it will take
आए
me.
बहुत बड़ी बात है. बहुत हमारे लिए मतलब कहते हैं ना एकदम.
नहीं. Thank you.
That's great.
Adit sir, I would request you that I will just introduce the officials from Gitanjali University and those whom you have invited. You kindly introduce to the audience.
Sure, definitely.
This should not be mistaken. It's a really good, sir. Really good to have you, sir. Yes, sir. Pratim Damoli, sir. Welcome, sir. We acknowledge your presence, sir.
Very good morning.
So I can see that I acknowledge presence of our honorable Vice Chancellor, Dr. F.S. Mehta Sahab, Dr. P.K. Rajput Sahab, the renowned industry personnel, and Dr. G.T. Kulkarni, Dr. Nikhil Verma, Dental College Principal, Dr. Shivani Desai. I'm just reading the name whom I can see on my screen.
Yes, sir.
Yeah.
So I'll just introduce P.K. Rajput sir.
Yes, sir.
P.K. Rajput sir is actually, vertical head and senior vice president at Cadila Pharmaceuticals, Ahmedabad. So he's joining us today.
Sir, most welcome, sir.
Thank you, sir. Thank you, Mehta sir. Very happy to see
welcome.
you.
Welcome, Mr. Rajput.
Yeah. So I'm in quarantine, so that is the reason I'm in a very different place. So
That's fine. That's meant for you only.
Thank you,
So
sir.
that's actually, we got a chance to meet you. Otherwise, this time, so whenever I, try to contact you, you are always busy in meetings and every,
Sir,
right, news.
sir, the pleasure is all ours, sir. That
Yes,
it is a
definitely.
surprise, really.
Thank you,
I'm
sir.
very
Thank
glad.
you, sir. Thank you, sir. Thank you.
So I think this registrar sir is just joining.
We have very good number in YouTube as well, sir.
Yes, sir. For students, actually, we have shared the YouTube link, and the students will see this program live streaming, sir.
Yes.
I am not able to see Mayur Rahul sir. Mayur Rahul sir, if you have joined, kindly confirm, sir, so that we can begin the program.
I think he hasn't joined yet.
Yes, sir. I'm not able to see him, and I'm calling, but not able to have call connected with him. I don't know whether just is disconnecting immediately. So in the I think sir, in the due course of time, the persons who are not there, they will be joining there. So
Mahendra sir,
yes, sir.
आपने ठंडी मणिपाल में भी भेज दी है एक्चुअली.
No.
आज हमें भी यहाँ पे ठंडी लग रही है.
So I think Mr. Rawal will be joining in a while.
Yes,
But Ahmedabad में फैन शुरू हो गए सर.
ओहो.
Yeah, so already fan has started.
Rahul sir, if you are there in the meeting, kindly confirm so that we can start. No, it's not visible actually. The name is. So with the kind permission, Mehta sir, should we wait for or we can start, sir?
No, we can start.
Yes, sir.
Let's start everything in time.
So with your kind permission, sir, I would like to start this opening ceremony and launching ceremony of this certificate course that is jointly offered by the Gitanjali Institute of Pharmacy, Gitanjali University, and Climate Research Solutions. So may we have your permission, sir?
Yeah, please.
Thank you very much, sir. So a warm good morning to all dignitaries and audience who are present at this launching ceremony of the online certificate course on diabetic pharmacotherapy. It is my extreme pleasure to share with you that today we are having with us our chief guest, Professor F.S. Mehta Sahab, Honorable Vice Chancellor of Gitanjali University, Udaipur, Rajasthan. We are glad to acknowledge the gracious presence of our guest of honors, Shri Pratim Tamboli ji, CEO of Gitanjali Medical College and Hospital, Shri Mayur Rawal ji, Honorable Registrar of Gitanjali University. So we are glad to share that the Dean of GMCH, Professor Dr. Narendra Mogra Sahab, is joining in a while. The Dean of the Gitanjali School and then Dr. Sanjay Gai, the Dean of Gitanjali School and College of Nursing, Dr. Nikhil Verma, the Principal of Gitanjali Dental and Research Institute, and the Principal of the Gitanjali College of Physiotherapy, Dr. Pallav Bhatnagar, also have joined us for this program. Sir, we are happy to share that the principals and faculties from various pharmacy institutes of Rajasthan and India are also joining this program. Sir, I would like to brief you about this certificate course. So this course is jointly offered by Gitanjali Institute of Pharmacy and Climate Research Solutions. Sir, we are having Dr. Ajit Singh, CEO of the Climate Research Solutions, and his entire team with us. So before moving ahead, so just I would like to have a few minutes to just show you the glimpses of the events that we have conducted for past 1 year of the Gitanjali University. So
Yes, sir. Please go ahead, sir.
so is my screen is visible, sir?
Yes, sir. Your screen is visible. You can make it full screen, sir. No
Yes,
problem.
sir. Yes, sir. I'm not able to do this thing. So is it visible now in the full screen? So just
Not yet, sir.
No, I can see that.
Okay.
is it visible now, sir?
No, it's not a full screen.
Yes,
Yeah,
sir.
it's visible.
Yes,
Yes,
sir.
fabulously visible.
Yes, sir. So, sir, this is just a small PPT that I would like to brief you about this Gitanjali University.
One sec. I think I have to switch off my inverter.
Yes, sir. Please, sir. Ajit, sir. Yeah, it's moving now. So this is a beautiful sprawling campus that is located at the ranges of the Aravalli Hills at Udaipur, Rajasthan. So this is a top leadership with the vision of achieving excellence in education. Our Honorable Chairman, Shri J.P. Agarwal Sahab. His motto is the journey from good to great. Our Vice Chairman, Dr. Shri Kapil Agarwal ji. Our Executive Director, Shri Ankit Agarwal ji, who are always saying that excellence is our habit. We are having our visionary educators, Dr. R.K. Nahar Sahab, Professor, Pro-Chancellor of the Gitanjali University. Our Honorable Vice Chancellor, Shri F.S. Mehta Sahab, he is having the vision to lead this university to the greater heights. This Senior Administrator, Shri Bhupender Mandya ji. Our Registrar, Shri Mayur Rawal Sahab. The Chief Executive Officer of GMCH, Shri Pratim Tamboli ji. So this is our vision of GIP is to become the center of excellence in the pharmaceutical education and research. So this is about Gitanjali University, that the university is spreading over 50 acres of the sprawling campus and equipped with all modern facilities and updated infrastructure. So we are having the 5 constituent institutes with us, that Gitanjali Institute of Pharmacy is one of them, along with Gitanjali Medical College and Hospital, Gitanjali College and School of Nursing, Gitanjali Dental and Research Institute, the Gitanjali College of Physiotherapy. We are offering the various courses of the pharmaceutical sciences, that is Diploma in Pharmacy, B Pharm, Pharm D, Pharm D PB, Master in Pharmacy in Pharmaceutics, Pharmacology, Pharmaceutical Quality Assurance, in addition to the PhD program. So here is the recognitions that we have achieved for the Gitanjali Institute of Pharmacy. We are the spoke, that is NPTEL local chapter SWAYAM. Recently we have filed a patent that is on the analytical method development. So we are also hosting a student chapter as the Gitanjali University India student chapter in from the SPORE, that is recognized by the SPORE USA, that is the International Society for the Pharmacoeconomics and Outcome Research. We have so far collaborated with the 2 industries. One is the MedNext, that is located at Udaipur, and the another one is the Climate Research Solution, with whom we are launching this ceremony. So here are some news clips. That one program that we have conducted here with Dr. Ajit was there as a resource person. And these are some few webinars that we have conducted during the pandemic, and that we were not sitting idle, and we were continuously sharing the knowledges through the online platforms. So here we have celebrated the last year, the 59th National Pharmacy Week, where the renowned persons from the academia and industry were there. Dr. Ranjit Bharshikar was the chief guest in the valedictory function, along with the chief guest Professor Dr. T.V. Narayana, President of the Indian Pharmaceutical Association. Here is the news clips. So we also have the partnering institute for the ISMTM 2020 with Climate Research Solutions.
And 2021 also, sir.
Yeah, 2021
Sorry
also.
for interruption.
So it's and this is one of the student she got this first prize, and this poster presentation on the topic of the descriptive review of potential drug disease interactions affecting COVID-19 patients and comorbid cardiovascular diseases. So here we are again the partnering institute for the vaccine safety and monitoring and reporting series. We have celebrated the World Health Day on 7th of April. So here also we have organized one program with the ULET's Edu Talk that is on the learning management system and the role in the higher education to digitalize the whole process. So here is a certificate of. Then we continuously have been conducting the various webinars for our students so that they can get the glimpses of the latest updates of the pharmaceutical industry in academia. That is the role of clinical pharmacist in the healthcare and research. Then we had a PharmD research project design webinar by Dr. Isha Goda. Then one of the my previous colleague has conducted this webinar on the pharmacist and NABH accreditation of the hospitals, which with emphasis on the chapter 3, that is of the management of medication. And this is Dr. Mr. Mohan Seshadri. He is the mentor and coach of the and worked with the various industries like Dr. Reddy's, Sun Pharma, Ranbaxy, AstraZeneca, GlaxoSmithKline. So he has discussed about the ideal career options in the pharmaceutical sector and briefed about the developing the desired skills for the procuring jobs in the pharmaceutical industry. So here with the collaboration of the ISPOR student chapter that we were having the Dr. Mahendra Rai. He is the resource person. He was the resource person in this webinar on the health economics and real world evidences. The webinar was conducted by the two resource persons, Richa Goyal and him. Then we conducted, sir, I would like to draw your attention that we have conducted a quiz competition in which the students of the senior schools students have participated. Around 1,000 participations were there across the all 26 districts of the Rajasthan state. So this was a huge competition and the students were benefited. We prepared one COVID-19 booklet and we shared with the students. And the students and the questions were being asked from this booklet, and they just did this thing. So here are some few glimpses and the newspapers. So we were having the 4 students who were selected for as a research intern through the in the remote mode from the PharmD students. So here is the program that we organized with Dr. Ajit Singh as a resource person, that is clinical pharmacist in the health research and development and entrepreneurship. So here were some glimpses. So here is the one brochure that is showing this career options in the pharmacy. And here is the brochure that prepared for the Doctor of Pharmacy Postbaccalaureate program. So this is one principal award that I received recently. So this is about the Gitanjali Institute of Pharmacy in Gitanjali University. So I would stop sharing and will be coming back to this main course of program. So Dr. Ajit, I would request you to please introduce the other guests who are present there from your side, and
yes, sir. Definitely, sir.
Very few briefing about this program, and at a later stage we will just inaugurate this.
Sure, sure.
Please,
So,
over to you, sir.
Sure, sir. Thank you very much. And first of all, I'd like to welcome you everyone here on this platform, and very warm morning from Manipal. It's quite hot there, 29 degrees right now. And so I'll come to my firm, Keynote first. So Keynote, we have started in 2019 after my PhD in cardiology. And this is actually, a CRO, contract research organization. And then, we have started all the facilities of, medical writing, regulatory affairs, third-party clinical trials, pharmacovigilance, and data analytics. And we have our registered office at Gurugram and corporate office at Hyderabad. We also furnishes the services in various areas such as research consultations, career consultancy, project management, and in 2020, when the corona came, we have started our separate wing called CliMed Educational Services. So under the CliMed Educational Services, we are bound to provide the quality education to the pharmacy field. Right now, we are in the pharmacy field, and we are entering into the medical very soon, medical and nursing. And we are conducting multiple courses and training programs, webinars, conferences. Recently we have conducted our trademark conference, ISMTM, International Symposium on Medication Therapy Management at Hyderabad, Sultan Udum College of Pharmacy, Hyderabad. And we got a wonderful response in the month of December in this pandemic. Month of November, 12, 13, and 14th November in Hyderabad. And then in December, we have conducted a big, online conclave where I have invited, and my team has invited, around 24 respected principals and academias, and from the industry, all top A-level, officials. So Mahendra sir was there, Dr. P.K. Rajput sir was there, and I can see many names here who are today joining us as well. So first thing, I would like to say, and I'm very happy, when we have started our educational services in August 2020. So we have started with one course called Basics of Cardiac Pharmacology. And this course was completely free because that is my vision. And I always feel like, of course, people say that free education doesn't make sense, frankly, because, people take it for granted, and, they do not, work properly. They do not, respond properly. It happens with me as well. But I'll say, you guys, you believe me, in that course, we got 11,600 admissions from 24 countries. From 24 countries in one course. That was the biggest and largest number of participants in any course. And this was the record-making course for us. And final retaining, final retention was around 60%. So at the end, around 1,500 participants got certificate from us. They participated in the classes. They came together and learned from us in the cardiac pharmacology field. And after that, in the COVID starting only, we were the first in India to, bring together both the vaccine makers. In February 2020, just 20 days after the launch of vaccines, we called, I'm so sorry for this. So actually, I'm in my house. So, we called both the vaccines maker, Serum Institute of India, Bharat Biotech, in the February 2020, just after 20 days of vaccine launch. And we called our DCGRI we called our DCGRI for this. And he also came for the first time in public and, talked about the vaccine safety and monitoring and about the vaccinations, COVID vaccinations. So we were the first, and we conducted the program for 7 days, that awareness program for 7 days. And Gitanjali was a part in our ISMTM as well as in our vaccine safety. And after that, we are exponentially growing as a research and education service provider. And right now we are in the MOU, under the MOU with more than 100 colleges in India, and we are providing great services. Of course, we somewhere we sometimes miss because we are new and we are learning. But yes, we are always fulfilling our commitments, and we are trying to get the promises done very soon. So yes, that is about PMED Research Solutions. And our leadership, I must say, we all are our MD Sahab is she's PhD in cardiology and pharmacology again. Our another partners and our another professionals and officials of PMED are all are the PhDs and MDs, and they are well educated and well sufficient to carry out their job and to carry out the things. So with this, I'll come to the guests who are here in the list. I will introduce one by one. So I can see here Dr. Sanat Kumar Naima. He's from KLE University, Belgaum. Dr. Shivani Desai is one of our resource person as well for this course. She is from DY Patil University, DY Patil Institute of Pharmaceutical Sciences and Research, Pune. And I can see Dr. P.K. Rajput sir. He doesn't need any introduction. He is the vice president and a vertical head at Cadila Pharmaceuticals, Ahmedabad. I can see Giriraj T. Kulkarni sir. He is the principal at Gokaraju Rangaraju College of Pharmacy, Hyderabad. And I can see Dr. K.V. Ramnath sir. He is HOD of Pharmacy Practice at DS University, Dayanand Sagar University, Bangalore. I can see Muhammad Sohail Akhtar Sahab. He is at Integral University. And I can see Dr. Sobhit Raj. He is from NIMS University. From my side, I can see Dr. Tariq sir. He is the head of pharmacy at Integral University. You're welcome, sir. Welcome, everyone. And so these are the guests I know and I welcome, but I welcome everyone to this platform. And Dr. Kiranmai Mandwa is also here. She is the vice principal at St. Paul's College of Pharmacy, Hyderabad. Welcome, ma'am. And we have Dr. Ashish Kumar Saha as well here. He is working as head of clinical pharmacy at the hospital Ranchi. So welcome you all. Thank you very much for joining. And if I left anyone, I don't think so. But you're welcome to this platform. Thank you very much, sir, for giving me the opportunity. Now I'll come to the course. I remember because, I was very much inspired from the cardiology course, and I, opened this diabetology course, diabetic pharmacotherapy course, 3 months diabetic pharmacotherapy course for everyone. And what is the, reason behind, the diabetes? Because I'm working for ICMR as scientist, research scientist C. So, my research area has totally, changed from cardiology to diabetology right now. And I'm working on the, young diabetes. And so I thought India is the hub of diabetes. So why don't we, aware our people, aware our students on, diabetic pharmacotherapy, because, diabetes has multiple drugs and multiple side effects as well. Just for an example, the long-term therapy of metformin can cause vitamin B12 deficiency anemia. So there are certain drugs which can cause the kidney problems, which can cause multiple other problems as well. So I thought to come up with this program, and we have designed. And the first day, I got a call from Mahendra sir, and I was discussing with him. I always, take his suggestions. I always take, suggestions from, my beloved colleagues and my, partners and my stakeholders always. So he was like, "Hey, sir, I would like to, come together for this course," and I was very happy. And I'm really, pleasure right now to collaborate with Geetanjali University for this course. And that is the day we are launching. And I hope everyone can join. Everyone can join. And the cost of the course, when we estimated, was quite high, around 3,000, frankly. But that was my passion to do it completely free of cost for everyone. So at the end, we came up with the just technical charges of 99 rupees, because we have to provide certificates. We have to do some technical aspects from our side. So that's why we are just charging 99 rupees from everyone. And there's no other charges except 99 rupees. And these all will be, just a social responsibility from our side. And I'm very glad that, Mehta sir, I got a chance to meet Mehta sir in my last visit in August when I visited Geetanjali University. So it was a pleasure meeting you, sir. And I hope this collaboration will go long with, many more fruitful updates and, in next programs. Thank you very much.
Yeah. So thank you, Dr. Ajit, for this nice introduction about the program. And then now I will move ahead with this launching ceremony of this certificate course on the diabetic pharmacotherapy. So foremost, I would I welcome on behalf of Geetanjali Institute of Pharmacy, Professor F.S. Mehta Sahab, our Honorable Vice Chancellor of the Geetanjali University. And we would like to hear from you, sir. Before that, I would like to just showcase the profile of our Honorable Vice Chancellor. So just I will read it out here. So it is my privilege to read out such a rich profile of our Honorable President, Vice Chancellor of the Gitanjali University, Udaipur, Rajasthan. Dr. Mehta has completed his MBBS in 1973 and MS General Surgery in 1977 from the renowned institute, R&T Medical College, Udaipur. Dr. F.S. Mehta is having a rich experience of about 43 years in various capacities at India and overseas in the medical sciences area. He served as a civil assistant surgeon at MG Hospital, Banswara, as SDM Hospital, Jaipur, SHO, Cardiothoracic Surgery, Freeman Hospital, Newcastle, United Kingdom, and as a specialist in the surgery at Dammam Central Hospital, Saudi Arabia. He came back to India to serve our country and commenced working as assistant professor and raised himself up to the position of senior professor of surgery at R&T Medical College, Udaipur. Later, he became the medical superintendent of the biggest government hospital of the Mewar region, that is MB Hospital and R&T Medical College. So afterwards, he served the Gitanjali Medical College as professor and dean. In February 2021, he was appointed as a president or vice chancellor, and currently he is guiding all of us in the various academic research, administrative and other aspects. So sir, we are fortunate enough to have opportunity to work under your able leadership. Dr. Mehta has conducted several examinations at the UG and PG level and guided the PG students of the medical sciences. He is having enormous number of publications in the journals of the national and international repute in his credit. Professor F.S. Mehta Sahib is a member of the Medical Council of India since December 2013 to till date. He is also a life member of the Association of Surgeons of India and life member of the Indian Medical Association. He is the life member of Indian Association of Surgical Gastroenterology and also the life member of IASO. So he is a trustee of the Dr. Shurveer Singh Trust, R&T Medical College, Udaipur. And he, based on his significant contribution in the healthcare, he received the District Administration Award for the excellence in the community services from the government of Rajasthan on the 15th of August 1996. So with this, I would request Professor F.S. Mehta sir to kindly address this audience so that they can get benefit from your vast experience. Sir, please, sir. Over to you, sir.
Thank you, Dr. Mahendra. That was a very long introduction you could have done away with. Co-organizers of the program, Dr. Mahendra Singh Rathod, Principal, Gitanjali Institute of Pharmacy, Dr. Ajit Singh, CEO and co-founder, Keynote Research Solutions, all deans and principals of constituent institutions of Gitanjali University and other colleges, CEO GMCH Pratim Timboli, and all dignitaries and faculty of pharmacy present in launching ceremony. It's a matter of great privilege and pleasure to launch this very relevant online master's certificate course in diabetic pharmacopathy, and that too free. COVID pandemic has brought back our focus again on very important disease, diabetes, and its treatment. India is known as the diabetic capital of the world with approximately 63 million total diabetic population. This 90-day free master certificate course in diabetic pharmacotherapy is a comprehensive learning of diabetes from the experts, clinicians, and academicians. This course is jointly offered by Keynote Research Solutions India and Gitanjali Institute of Pharmacy, Gitanjali University, Udaipur, Rajasthan. India as a value-added advanced skill development initiative under industry academia collaboration for academic and research development. The course has been designed to cover every aspect of the research, therapy, pharmacology, pharmacy, and clinical practice. Diabetic patients are very likely to benefit from good adherence and proper implementation of specific recommendations. It also includes the common but serious problems that are ignored in general practices, like insulin techniques, side effect profile of treatment, and patient guidance and counseling. The course covers all the aspects following the latest guidelines and evidence-based practices, including the latest drug clinical trials, COVID-19 and diabetes, and young patient diabetics. Gitanjali University, as already introduced by Dr. Rathod, is one of the leading universities of Rajasthan located at Udaipur in the range of Aravalli Hills. The university has a beautiful lush green campus, which you have already seen in the slide presentations, sprawling across more than 50 acres and is equipped with all modern state-of-art facilities to provide quality education in fields of medical, dental, nursing, physiotherapy, and pharmacy. Kitan University offers a wide range of graduate, postgraduate, and doctoral programs in various disciplines. Gitanjali Institute of Pharmacy is one of the constituent institutes of Gitanjali University. The institute was established in the year 2006 and is approved by the Pharmacy Council of India to conduct pharmacy programs, diploma in pharmacy, B.Pharma, PharmD post-baccalaureate, and M.Pharma in pharmaceutics, pharmacology, and quality assurance. The institute also offers PhD program at Gitanjali University. GIP has consistently been rated as one of the top pharmacy institutes in Rajasthan as is part of the most comprehensive academic health science center. Students learn from leaders in pharmacy education and research, as well as an interdisciplinary team of faculty and healthcare professionals. Would like to congratulate our principal, Dr. Rathod, for raising the bars of this institute in the pharmaceutical educational field. The institute promises to play a key role in producing highly skilled pharmacy professionals to fulfill future demands of the pharmacy sector and provide an opening to the young and talented students of the country. The faculty and students of JIP are actively engaged in research and development activities and have published a large number of research papers in journals of national and international repute. The institute has conducted a range of conferences, seminars, webinars, workshops, sponsored by agencies like ICMR, DST, DBT, APTI, and others. GIP hosts India Student Chapter of International Society for Pharmacoeconomics and Outcome Research, ISPOR, USA. As an academia industry interaction initiative, GIP has signed MOUs with industries for academic research, training, and placement activities. GIP as an extension center for online learning under the aegis of a project of the Ministry of Education, Government of India with the NPTEL Swayam. Alumni of JIP are holding good and reputed positions in India and abroad in the field of pharmaceutical and allied sectors. Gitanjali Institute of Pharmacy had collaborated with Climate Research Solutions, Gurugram, for initiatives like the commencement of value-added courses, establishing Drug Information Center and Center of Excellence in Clinical Research. I'm sure this online certification course will benefit tremendously all knowledge seekers. My best wishes for success of the program. Diabetes has multiple organ involvement and leads to multiple complications in body. I would like to end my talk to narrate a brilliant OD for diabetes and its complications. I don't know who wrote it, but will certainly fetch full marks if a final year student, MBBS student, writes a long answer on complications of diabetes. So here is a brilliant OD to diabetes. Wounds that don't heal, nerves that don't feel, no food I can eat at ease. What a disease I have, diabetes. Specialists call me by another name like tripathy or tripathy, as I induce painless or painful nerves neuropathy and also vandalize the vast vascular network vasculopathy before I damage the camera of the eye retinopathy. It is not due to what you eat, khatta or meetha, but as your lifeboat wrecks on the Isles of Langerhans. Even though you feel secure with the insulin of Best and Benting, alas, the ultimate cure is still wanting. As all your diet fails, you put on tablet. Your therapist says, take it or order your stone tablet. As the needle-less therapy still cannot prevent you becoming lean, you lean on needle therapy with insulin, from which you may not wean, makes me pee all day and night, putting me at stand at ease. No more about turn once I develop hypertensive disease. The nephro says, no more kidding with your kidney. Bag, borrow, or steal to live on with your kid or kin's kidney. As the moiety forms the callous cataract with the society, you fail to interact. All the afflictions of the errant eye, if you don't care, may bid a permanent buy. You ask your queen of hearts for some more tart. Risk not, dear, no more of them, comes the reply so curt. Even as your ego takes the beating with the heart, odd becomes the arrhythmic beating of your heart. As you cannot rise to occasion and vex, the urge ushers you to the sentinels of specialist insects, waxing and waning of the velocity of your life's Niagara, calls on you to fall on the pellets of Viagra. When all the faltering organs invite diabetic coma, your soul plays dilly-dallying within your soma. Even as you recollect all the deeds of your karma, there comes the appointed time with the Yama Dharma. Initiated by the inaptitude and apathy, failing to gain sympathy, you wander this hither from neuropathy to homeopathy. If all your pathies cannot be allayed even by allopathy, you become their prey or prey Venkatachalapati. Thank you very much.
It was such a nice poem that has elaborated all these symptoms of diabetes, nicely quoted, and it's really very good, sir. So thank you very much for your address and all the audience.
Sir, I would like to acknowledge the presence of Pragna Ella, Miss Pragna Ella. Mrs. Pragna Ella, she is the chairperson for IPA Student Forum for all over India. She's the national chairperson, and she's there with us today. And we have Dr. Raghukran NR, sir. He has been into the DIC of Government of Karnataka, and
so we welcome on behalf of Gitanjali Institute of Pharmacy, sir.
Welcome all of you. Thank you very much.
Dignitaries.
And Surendra Manuri, yes, you're welcome. Welcome, sir.
So shall I proceed further, Dr. Ajit?
Yes, sir. Yes, sir. Yes, sir, please.
On behalf of Gitanjali Institute of Pharmacy, that I welcome all these dignitaries whose name could not be taken. So we please pardon us.
Someone is can I will request everyone to put their mics off. Okay, I'll do that. No problem. Thank you. Yes,
Okay.
yes, sir. Please go ahead.
So just I will move ahead. So that we are having another guest of honor. So before that, I would just like to acknowledge that our registrar Shri Mayur Ravalji has joined, but he is not able to speak because he became positive. And though he is listening this program, and just now I received the message that he is not in the position to speak out. So that is not an issue, sir. That we acknowledge your presence, gracious presence for this program. So I will move ahead with our another guest of honor, the one and only Shri Pratim Tamboliji, and that who is the CEO of the Gitanjali Medical College and Hospital. So Mr. Tamboli is having post-graduation in the hospital and healthcare management from IIM Ahmedabad, and he also has completed his hospital management from MDI Gurgaon and IIM Bengaluru. He has been the Healthcare Administration and Administrative Staff College of India. He attended that as ASCI. He got the degree in the Pharmaceutical Sciences and Management B Pharm from Rajasthan University in 1994 with the gold medal. Shri Tamboliji is having a rich Indian and overseas experience of about 25 years, out of which 5 years were with the Indianapolis, USA-based MNC Eli Lilly and Corporation, and then 18 years in the Fortis Healthcare, and over 3 years, for the past 3 years, he is associated with Gitanjali Group as a CEO of Gitanjali Medical College and Hospital, Udaipur. Shri Pratim Tamboliji is having excellent leadership, analytical, presentation, communication skills, and exposure to the various market segments of the healthcare industry. He is serving as a Chief Executive Officer since December 2018, and he is holding responsibility for the healthcare delivery of a 1200 bedded hospital under the Gitanjali University. The university is having the different institutes that Professor F.S. Mehta Sahab already have narrated. So he has remained associated with Fortis Healthcare Limited since year 2000, and he was founder member, General Director of the Fortis Hospital Limited at Jaipur since June 2012. He is the member of various reputed bodies like CII Rajasthan and FICCI Rajasthan. He is the president of the National Chapter Human Resource Development of Rajasthan, and he is the vice president in AHPI, and also is a board member of AISEC India. Shri Tamboliji is also the board member of the IIHMR University Jaipur, and also the board member with the Purnima University. His current key responsibilities are in the clinical and organizational operations, business performances, and community connect. So, sir, we acknowledge your gracious presence to this launching ceremony of the certificate course that is jointly offered by the Gitanjali Institute of Pharmacy and Gitanjali, this Climate Research Solution. So, we request you to kindly address the audience. And so, over to you, Shri Tamboli Sahab.
Thank you, Dr. Mahendra. Distinguished guests today on this Zoom call, our Vice Chancellor Sahab, Shri Dr. F.S. Mehta Sahab, CEO and founder of Climate Research Solutions, Dr. Ajit, Dr. Nikhil, Mr. Mayur, distinguished guests from the industry at various organizations. It's my privilege to be the part of this August gathering today. I'm pleased to share that the course which has been constituted in the current scenario of along with the climate and Gitanjali Institute of Pharmacy under Gitanjali University. I wish you all the best and a great success for the legacy which you have created recently, Dr. Ajit, with the great number of registrations which you did with the research program and the course which you conducted for cardiology. I'm sure that the legacy would continue. The organization at Gitanjali University is committed to offer international level of quality education under the leadership of our Vice Chancellor Sahab, Shri Dr. Mehta Sahab, and our Chairman Sahab, Shri J.P. Agarwal ji, and the Executive Director and Vice Chairman, Shri Ankit ji and Shri Kapil ji. The very significance of this course brings to me an example that recently when the world suffered from COVID-19, a lot of studies were conducted in 2020 and 21, particularly for patients who are suffering from diabetes. Diabetes, I think, very well been explained that it's one of the major diseases today, and it's more of a lifestyle rather than a disease since last so many years. And India has got a large amount of patient strength today who are suffering from diabetes. While the treatment of diabetes has been oral hypoglycemic agents, and some of the key studies suggested that almost 10 to 19% of the patients who were hospitalized with COVID-19, they were diabetic. And if you see the ACE inhibitors and angiotensin II receptor blockers, the ARBs, they are considered to be the first-line agents with patients who are suffering from diabetes because of their nephroprotective effects. But administration of these drugs, it led to upregulation of ACE2, which is responsible for the viral entry of severe acute respiratory disease syndrome, SARS-CoV-2. And thus, if I see what was the reason for treating and administering a drug led to more number of patients suffering from diabetics suffered from COVID-2 as well. That means that today, whatever we treat through our medication regimen and medication therapy, we need to understand what are the future challenges we need to have, and that's the significance of pharmacovigilance and pharmacotherapy studies for all the major diseases which have such a high amount of people suffering across the world. This industry academia collaboration of a course which is online for 90 days, I'm sure it would support and facilitate many such interesting students who are interested to do something which is, I would say, more than what is the normal. It's surely is going to pay a strong foundation to know more about the disease and the treatment methodologies which are being administered in the various hospitals, the pharmacovigilance of patients who are suffering from major diseases like cardiology or diabetes, and the assigned side effects like whether it is diabetic nephropathy, diabetic neuropathy, or diabetic retinopathy, and also the other concomitant for example, which was recently discovered, that patient who got COVID, they were more seriously injured and they were treated. They required treatment in intensive care units. They had a high demand of oxygen because of whatever the response mechanism was there because of the pharmacokinetics of these drugs. Thus, this would lead to a more futuristic programs in future where any disease which has got a large implication to the society and to the community would require to be studied more better with the treatment regimens which have been followed by the newer diseases. In this aspect, I congratulate you both, DIP, Dr. Mahendra Singh Rathod and Dr. Ajit Singh for constituting this course, and I wish you all the best. I'm sure that the outcomes when we study over a period of time in a 6 months period will leave a strong foundation for future courses as well. Thank you very much for inviting and letting me share my thoughts on this program. Thank you.
Thank you, sir. Thank you very much.
Thank you very much, sir, for sharing your thoughts. And so, this I also already narrated that Shri Mayur Rahul Saab is not feeling well, so that he was another guest of honor. And now, Dr. Ajit, I would request you to please invite, and on behalf of Gitanjali Institute of Pharmacy and Climate Solution, to Dr. P.K. Rajput, if he would like to share his thoughts.
Yes, sir, I'm looking for it. But before that, we have Raghukaran sir here. Raghukaran sir has a vast experience at Government of Karnataka in DIC, and he was one of the founder member of that, and he recently retired from that. I would invite Raghukaran sir to put his views on that. Raghukaran sir.
Is it there?
Sir, can you hear us? Okay, one sec. He was there with us right now.
Yeah, he was there, but probably not.
Raghukaran sir.
I think he left, sir.
No, he is here, but I think he's not able.
Yeah.
Yes, sir. Hi.
Yeah, hello.
Yes, sir. Raghukaran sir, welcome, sir. Welcome on behalf of Gitanjali Institute of Pharmacy, sir.
Thank you. I'm very happy to be involved in this type of program. It is going live to all the play. This one, I wanted to add something to it. This comes under national. Now education policy is changing in pharmacy field also, and in digital era, you are taking this to the whole India. Very good initiative from the Gitanjali Institute. Thanks for all the efforts, and also from Ajit Singh, who have given me opportunity to speak on this one. Thing is, in Karnataka, as I come from the service sector, here we are taking as a national NCD program, non-communicable disease program in clinics. We are doing in a service level, and service and university level, we have to bridge. There is a gap between that. That bridge, definitely this interns and also NSS unit of all the pharmacy colleges can do a wonderful work in this one. There's a lot of work opportunities throughout India. And I expect the participants who are going through this will take this move a big forward in the whole India, because there are 780, more than 38 districts in India. Now the supply system of all the instruments, everything has been very much improved to the COVID this one. So bridging with the medical colleges, supply system, and also education curriculum development from the university level, and also support from the professionals, working pattern, they can bridge the gap, all these things. So thanks for the opportunity given. Thank you very much. That's all from my end. Thank you.
Sir, thank you very much.
Dr. Ajit, just I would, before that, Honorable Vice Chancellor sir, just he messaged me that he would be leaving. So that I would request all the participants to please open your camera so that we can have a snapshot for this event.
Yes.
So Dr. Ajit, will you please tell somebody to do this thing?
Yes, definitely. I'll tell my team to click the pictures.
So I request to all the participants, Dr. Ashish Kumar, Dr. Shivani Desai,
everyone, please, Dr.
Nipun Dashora,
whoever is
able to open
their cameras.
So please open your cameras so that we can have a snapshot. Dr. Yashpal, Mr. Yashpal, Shobita Raj, Ma'am Lalit Singh Ranawat ji, Dr. Udichi Kataria, this
I can see
Raj.
Sonika madam here. So she's working at, ma'am, your mic is off. So she's working at Government of Haryana as a pharmacy officer.
Morning.
Hello, ma'am. Good morning. So thank you very much. We have clicked the picture, sir. And now I would like to, okay, sir, sir, you please go ahead, Mahendra, sir.
Yeah, just from Gitanjali University, that speakers are there that I told that Shri Mayu Araval sir is not feeling well. So that I would request Dr. P.K. Rajput sir to kindly share your views over it, so that the community, though it is just we are surprised, sir, that it's a very pleasant surprise for us that you to be here.
Yes.
Actually, we were planning for some event, and then I was just about to talk with you, with Dr. Ajit. And sir, you, Dr. Ajit, you will kindly introduce him, and then he can begin his talk.
Sir, please put your words on the course and your experience with us. That would be, our pleasure.
Thank you so much, and very, very good morning to all the eminent personalities who are here on this Zoom meeting. And thank you, Dr. Ajit, for inviting me. Mahendra Singh sir, my gratitude to you. I was very humbly listening the talk of Mehta sir, Pratim sir, the way he has said, because this is one of the very wonderful initiative which has been taken by the Gitanjali Institute as well as by the Climate. And I was just thinking that, see, diabetes is one thing which, yes, we all are working. And we all know that India is going to be a capital of the diabetes. Already the things are getting increased. And while we are working on the technology, so the people who are not able to do the exercise, the things are again going to flare up. So with this 99 rupees, the cost which you have put it, because I was thinking about the commercial side also. Any person will be able to join the thing. Because immediately first thing comes that how I'm going to pay, right? And with such a beautiful, nice faculty, with such a details are there, I think most of the people will be able to join. And it's a 3 months course, which I was listening. So this is going to give lot of enormous strength to the many of the students, many of the people to understand the thing. And I'm sure it is going to be one of the greatest feather in the cap of the Gitanjali Institute. And this is for the first time which is happening, because I have not heard any of the institute which has been collaborated, which is such a great way, and they are doing it. So my compliments and congratulations for a novel opening of this thing. And I'm sure it is going to be a great thing in the entire India. And many of the institute, let me tell you, after 3 months, 6 months of the success, they are going to follow it. Please keep my words. You will find that some of the institute, they will start following it, because the success is going to be there. The knowledge sharing is going to be there. The people are going to learn from it. And the way it has been designed, because Dr. Ajit Singh sir, I know that the way you design the thing very meticulously, you go on the point to point wise, and unless until you are not getting satisfied with the things, right, you don't open the thing. Because I have attended your couple of meetings, and the way very meticulously. And Rathod sir, the way Gitanjali is coming up, the way Gitanjali is making the things happening, this is going to give a lot of this positiveness to the entire India, because there are institutes which are doing it, or the D pharmacy and all. But you are the by Pharm D. Pharm D is the real buzzword which is there. People, they keep on asking that whether how many places it is there. And 100% the name of the Gitanjali is coming there in that, because since I'm in advisory board of the multiple institute and all, so they keep on asking. They talk about the Bombay, now they talk about the Gitanjali Institute. So this is one of the great things. So my great wishes to you, and any type of help which you feel that I'll be able to add, I'm always there. I never say no to the thing, because I feel that the youngsters, they require a lot of these things which is there. So with this, thank you so much. My once again gratitude.
Thank you, sir. Thank you very much, sir.
So nice of you, sir, for the kind words. And we are just मेरा सर आधा 1 लीटर खून बढ़ गया सर. आपने comment दिया that there's really a very good compliment from you, sir, that this Gitanjali is having recognition over all over India, sir.
सर है सर, because क्या था कि देखो, मैं पूर्णिमा यूनिवर्सिटी का I'm an advisory board member. I'm a part of IIHMR. So when I talk about the institute which are there from the Rajasthan, then I am also a part of the various institute. So they talk about that how Gitanjali is flourishing, how the things are coming. Because लोग बात करते हैं ना, यहाँ पे भी I heard that some of the dignitaries is there from Purnima. So Paddy साहब से जब मेरी बात होती है, जो the director, right, from Purnima. So he speaks about it कि भाई ये हम कर रहे हैं, हम ये करने वाले हैं, हम ये करने वाले हैं. तो naturally जो अपने बाकी के जो लोग बढ़ते हैं उनकी बात होती है.
Sir,
It is not a comparison, but at the
It's a-
same time, it is saying how we can further go ahead. And
Yes.
Gitanjali is a name to be recalled. Let me tell you very clearly.
sir, thank you very much for
Thank
the
you, sir.
compliment, sir. It's a compliment for us.
And sir, I must say everyone that this is a track record by God's grace and touchwood. कि जब भी मैंने PK sir को बुलाया, he never say no. Never said no, not a single time.
आपका जादू है sir.
And I would add to PK sir, actually I was visiting multiple universities in August in India, which are providing PharmDs. So I was looking into the facilities because I'm getting lots of questions that how they are performing the PharmDs and how they are doing with the PharmDs and what could be done else. So I was seeing that around 80%, more than 80% colleges have one disadvantage, that their hospitals are not attached to the college or they are just far away. So actually PharmD is a clinical practice, so people and our students, aspirants, they need practice. They need to go to the patients, they need to do counselings and check the prescriptions, and they need real practice. So I'm impressed by Gitanjali, that Gitanjali Institute of Pharmacy and Gitanjali Medical College had just a difference of 8 steps. Just eight steps, only one road in between. This side their hospital, this side their college. So I'm very glad to say that students are very lucky, and that they have such facilities in Rajasthan. So thank you very much. So now we have around 10 to 12 faculties and resource persons for this course. All are very eminent and very known in the field of diabetes from multiple. I think someone is speaking. Let me just check. Can you please put off your mics, guys? Okay, no problem. I just put. So that we have around 10 faculties to conduct this course from multiple hospitals, and they are professors and associate professors of medicine. We have from outside India as well, who will teach this diabetology course or diabetic pharmacology or diabetic pharmacotherapy course to our students. So we have one of our resource person here with us, Dr. Shivani Desai. She is from DY Patil Institute of Pharmacy and Pharmaceutical Research. I welcome Dr. Shivani Desai, and I wish her to put her words on the course and how she's looking forward.
Thank you so much, Dr. Ajit, for this warm welcome, and very good afternoon to all the dignitaries, Dr. Rathod sir, Dr. Rajput sir, and all the esteemed guests present here. So I don't know, Dr. Singh, what should I say after what Dr. Rajput and Dr. Rathod has already told. But yeah, as they have, I've just repeat the same thing, that as they have said, diabetes is actually becoming a global burden, and especially in India also. Nowadays, we already know that type 2 diabetes is actually globally, it is very prominent. But unfortunately, even type 1 diabetes is going really high. The numbers are going really high in India as well as global, on the global platform. So I think this course is really going to be a good platform for the current students, PharmD students, as well as all the medical as well as paramedical students, to know more about different types of diabetes. Because as I could see the course, the curriculum of the course, Ajit has already given all the different types of diabetes, and I think he has not left a single thing. So this will be a power pack course for all the pharmacy and medical students, so that in future they can actually treat and such patients, and they can also add on the research value, because more the understanding they will have, more they will be able to work on those platforms. And I am very sure that there will be a next step in the management, in the pharmacotherapy of all types of diabetes. Type 2 we already have, but even other types of diabetes also, I'm very sure we will be having something new in the market soon, and this course will be a good step for it. So I really congratulate Gitanjali Institute, Rathod sir, and Dr. Ajit Singh.
Thank you.
And
Thank you, ma'am.
ClinMed
Thank you.
Research. Yeah.
Thank you very much. And I would add about Shivani Desai. Dr. Shivani Desai is working in the field of type 1 diabetes, and she's working on the vaccines of diabetes, type 1 diabetes, and she's very known and running the T1 DM website, and she writes blogs, and very famous blogs. Everyone around the world, they read about her blogs, and also she always update all the information about type 1 diabetes. So this is our privilege to have you, Dr. Shivani.
Thank you so much, sir.
And we have heard her name across. Let me also endorse
Yeah.
that she is a name to be recalled. Yes, Dr. Shivani.
Dr. Shivani
That is
Desai is, I would say, I must say now, she is our, what we say na, ke ye hamari family hai, Clemed ki family hai. She is our
Yeah, I'm
Clemed
obliged, sir. Actually, from first ISMTM, first time I met Dr. Singh in ISMTM 2020, and since then I have been following all his events and all. It is really a good platform for me also to learn a lot of things and share whatever I know. So thank you so much.
Thank you.
Thank you
Now,
very
ma'am,
much.
let me tell you one thing, because it is
Yes,
your
sir.
work which is like a coming up with a beautiful fragrance across. Because
Thank you.
whatever the thing which you are putting it, everybody is resonating the thing. So it is your sheer hard work and the thing. See, I am meeting you for the first time here on this platform, but I have heard about you, very positive, very good about you, and great work which has been done by you. So
Thank
that
you
is the
so
thing.
much,
Yeah.
sir.
So
really
it is
great.
not a compliment. It is a fact of your work. That is the thing which I just want to put
Yes.
in the
PK sir
forefront.
is,
It's, I'm glad, really. Thank you.
PK sir is my mentor as well, and whenever I need, I, go for the expert suggestions to him always. Sir, what to do?
Okay. So I'll also be reaching out to you now. Thank you, sir. Thank you so much.
So now, if Dr. Kulkarni is here, I would like to invite Dr. Kulkarni sir, Principal, Kokaraju Rangaraju College of Pharmacy from Hyderabad. Sir, I invite you to put your words here.
Good morning, sir.
Good morning,
Very
sir.
good morning,
Am I
sir.
audible?
Very warm welcome.
Yes, sir. You are very much audible, sir.
Yeah. Good morning, sir. Thank you for inviting me to this program. And even though I have not gone through the details of this program, but it appears to be very interesting. And I have circulated it to all our students also, whoever is interested, because it seems to be such certificates and skill development courses are really the need of our now. Just by completing B.Pharm degree or by completing M.Pharm degree, we are not going to be industry ready. Some skill development, some value addition is definitely needed, and it will be definitely going to be a really great help to the students. So I always welcome such things, and definitely I am forwarding to all my students and faculty, whoever is interested can join this. I hope this is not only for students, useful for the faculty as well, who are going to teach and who can be updated in their teaching also, whatever. So I would like to welcome this thing, and it is a really great step taken by Dr. Ajit Singh as well as Dr. Mahendra Singh. So I am highly thankful to you for introducing this good course.
Thank you, sir.
Thank you.
So now I would like to just showcase the flyer and brochure of the course, because till now we were not disclosing it. We have just circulated one initial flyer. So today is the chance for me to showcase this entire course in front of you, everyone. Thank you very much. So let me share my slides. So this is a course flyer. Looks like this: Master Certificate Course in Diabetic Pharmacotherapy. This course is jointly offered by Clemed Research Solutions and Gitanjali Institute of Pharmacy, Gitanjali University. And yes, here are the details. So this is the flyer, what we are going to share, and it will reach you in very short by today evening. So, and then let me share the full brochure of the course. I take you through the course full brochure. Okay, so it looks like this. This is the first page where we are talking about the course name, and then our joint effort by Gitanjali Institute of Pharmacy, Gitanjali University, and Clemed Research Solutions. And then here you can read all about the course, and here what are our social responsibilities and what is the history behind this course. It will be lovely to read. So, and then we can you can see all about the Gitanjali University and Clemed Research Solutions here in this course, and then who can attend. So guys, don't worry about the attendance. All the students from first year to final year, whoever wants to learn, because this course I made in a comprehensive way, where we are starting from the diabetes word, what is diabetes, and till the therapies and the latest updates, latest clinical trials about COVID and diabetes. So everything is involved in this. So if you want to learn the diabetes, please come and join. I invite everyone, from the medicine, from pharmacy, dental, nursing, Ayurveda, or any allied health sciences who wants to learn this diabetic course, please come and join us. And there is no prerequisite, as I'm telling, because this course will teach you through from the basic to advanced. And this is a 90 days course, 12 weeks, 12 modules we have fixed, and classes will be in the evening. So, I always, prefer to go online classes in the evenings when I am also free from my, daily schedules, and everyone is free. Students are free from their college schedules, so they can easily come and attend the classes. So these classes will be in the evenings, weekend evenings, and it will be live on Zoom and YouTube. So there will be no recording lectures, guys. If you're feeling that there will be recording lectures like other platforms, we do not practice recorded lectures at all. We always go live where students and participants can interact with the faculties directly live. So this course will be live on YouTube and Zoom meeting, and it is starting from 13th February. But yes, the last date of registration was 23rd January, and with the request and after the request to Mahendra sir, I have extended the date to 6th February, so more people can join and get benefited from it. And yes, guys, but very important disclaimer, I would say, and I would really so tell you, because according to the UGC guidelines, that is there, this course will give you the certificates at the end after conducting an exam, because exam is very necessary for any certification. So it will show your enthusiasm, it will show your learnings, what you have learned from the course. So you will get these things at the end, and after completion of the exam only you will be able to get the certificate. So 60% of attendance is live, or if you are not able to attend the live class, you can see the class later as well. We will have the recorded classes, and your scores would be more than 60% in the final exam. So final exam will be just MCQs. Okay, 50 MCQs, no written test, right? So these are the links you will get shortly for the national and international participants. So now we are for first time with we are opening for the international participants with paid. Otherwise, till now, whatever we are conducting, it is completely free for the international participants. So first time we are opening with some amount. And as I'm telling, 100% tuition fee is waived off, just technical charges we are covering. And now you will be amazed to see the course, what we are actually covering in this course. We are covering basics of diabetes, where history of diabetes, types of diabetes, biomarkers of diabetes detection, diagnosis and biochemical investigations, everything will be covered in this area of that. And then types of diabetes, we are covering all type 1 diabetes, type 2 diabetes, gestational diabetes, and young diabetes, including LADA and MODI, right? And then in diabetic micro and macro complications, we are, I don't think we are leaving anything, because nephropathy, ketoacidosis, retinopathy, and diabetic foot, and other diabetic complications like infections and cardiac complications are involved in this course. And if we come to the pharmacotherapy, we are including the latest vaccines, history of insulin, and all about the insulins, and all about the OHAs. And in the recent updates, we are providing COVID-19 and diabetes module. We are giving a clinical pharmacist perspective. We are giving recent clinical trials and update all about the diabetic drugs, and patient counseling, live case discussions will be there. So Dr. Mahendra Singh Rathod along with me are covering this course, and we have Dr. Sheetal Chauhan, our managing director at Climate Research Solutions. He is the director for this course. He will be looking after the course conduction, and we all will be there. So these are our coordinators. From Geetanjali side, Dr. Bhaktaraj Singh Chauhan, and from Climate side, Dr. Tarun Rashe. And if any question is there or any query is there, guys, you can straight away contact me. You can call me anytime. I am very much approachable. You can call me, you can talk to me, you can ask about your queries, and whatever is sometimes my team is busy in multiple things. So I'm sorry that, because I was getting some message yesterday also that they did not get ISMTM certificate. So I'm very sorry for that, but I spoke to my team and I have conveyed the message. Whenever if you are reaching us out after 6 months also, you will get your credentials. Don't worry about that. Okay, thank you very much. And this is about the course. Over to Mahendra sir.
So thank you, Dr. Ajit, and I would request all these participants and principals and faculty members present here, so that please circulate this information to the fellow colleagues and students, so that they can also get benefited with this beautifully designed course. And so if anybody is there from the audience having any question right now, or else we
Yes,
can proceed
floor
further.
is open for the questions, sir.
Yeah,
Yes.
this is open question answer session.
So one question is, when we are going to start this course?
Sir, 13th February.
13th of February you are going to
Yes,
start.
sir.
Okay. And you said it is in the evening. So what are the timings are there in that?
So timings would be, after 5 p.m. definitely, but we are, planning for 1.5 hour class, every weekend. So it will be around, 5:30 to 7 we are planning right now, but it will be somewhere 5 to 8.
5 to 8 on every weekend?
On every weekend, every day, 1.5 hour, weekends, 1.5 hour class.
Okay. So if suppose this 90 days course is there, right? Okay. So there will be like 4 and 4 and
There
4,
are
12 weeks.
there are 16 classes, sir. We have designed 16
16
classes.
classes, correct.
Yes.
16 classes are there.
16 classes.
Yes, sir.
Fantastic. So
Yes, sir.
it will be every after 4 weeks there will be some like test will be there, or after 16
No, sir.
classes only?
No, there is only one test at the end, one assessment at the end of the course. Yeah.
Okay. And suppose somebody has missed the class, so he or she will be able to go through it.
Watch the recorded classes in YouTube channel.
Fantastic. Very good.
Yes.
Very nice. Very nice. So good. And it can be taken care not only by the students only, it can be taken care by the general people also, because
Yes,
you see
definitely.
how it is diabetes and all, which
Actually,
is
I was supposed to. Yes, sir. I was
Yeah.
sorry to interrupt, but I was supposed to write even the patient and patient caregivers and
Correct.
So definitely anyone can join who wants to learn diabetes.
Very nice.
So, from faculty members of Gitanjali Institute of Pharmacy, if anybody is having any query regarding this course.
Anyone, if anyone have the queries, please raise. We'll be happy to answer, Mahendra sir, and I'm here. Sir, if no questions, then over to you.
Yes, sir. So that we can conclude the session by vote of thanks with the permission. So,
yes, sir.
Just Dr. F.S. Mehta Sahab also has left this meeting. So, I would extend my gratitude and thanks to all the renowned speakers, Dr. F.S. Mehta Sahab, Vice Chancellor, Gitanjali University, and Shri Pratim Tamboli ji, Shri Mayur Rawal ji, who could not make his presence visible here, but he was listening on this program. He is registrar of the Gitanjali University. And Dr. Ajit Singh, for your enormous contribution to the education of the students. I am very thankful to Dr. P.K. Rajput sir, who made this your presence convenient to this program. I am thankful to Shri Raghu Kiran NR sir, and thankful to Dr. Shivani Desai, to Dr. D.T. Kulkarni sahab. I am able to Madam Sonia Malik, all the faculty members of Gitanjali Institute of Pharmacy and students, and I am thankful to Dr. S.S. Sisodia, who is the principal of the BN Institute of Pharmaceutical Sciences, along with all the principals. I am not able to see if anybody missed, kindly pardon me. And so this is and just I am very much overwhelmed with the presence of the different dignitaries. And Dr. Ajit, the credit goes to you that you are really working very good, very nice in this sector. And hopefully we would be having a long collaboration in the various other sectors also. And at some point of time, we would like Dr. P.K. Rajput sir also to be here at our university. So certainly I would be in touch with you, sir. So thank you very much to all, and thank you very much to the team GIP and team Climate Research Solution, who made this event technically sound and successful.
I would like to thank you, sir, first of all, because without this collaboration, it would not have been this much successful. Frankly, see, affiliation from the university. I'm always, very bold in speaking and very clear in speaking. It would have not been that much successful without the university affiliation. So, I was getting multiple questions that because we are just 2.5 years old, and people do not believe on our face. When I go and approach, some random person, they tell you just, kid, you cannot do this. So we are very, very sorry to, collaborate with you. So it is again, thank you very much for your support. Thank you very much for the support of Gitanjali Institute of Pharmacy and Gitanjali University, who are standing with us constantly in all the events and, making them successful and delivering the quality education to all. So from my side, I would like to thank P.K. Rajput sir, Dr. G.T. Kulkarni sir, Raghu Kiran sir, Dr. Shivani Desai, and Dr. Mansi Mistry is here. She's from Parul University. And we have Dr. One sec, let me go through the list. We have Mr. Sohail Akhtar, we have Sonika Madam, we have Surendra Manuri, we have Sobit Raz and other faculties and principals who have joined us on my request and who are always supporting me. So thank you very much, and it was a great platform to share with you, everyone. Thank you very much.
Thank you very much, all of you, for joining us. Thank you, sir.
Thank you, sir.